Going to get a little. Good morning, I'm Kit Kramer, President and CEO of the Asheville Area Chamber of Commerce. Thanks for joining us this morning. Just so everyone's aware, this meeting is being live interpreted into Spanish. If you would like to listen in Spanish, there is an interpretation button at the bottom of the page. You can click to change the language of the discussion. And Rocio, if you will please share those instructions and repeat that in Spanish.
Sure thing. Muy buenos días a todos. Estamos aquí interpretando en vivo, así que les vamos a dar unas instrucciones de cómo ingresar al canal de español. Para acceder a la interpretación se va a ver de dos maneras. Si están por computadora, se verá como la izquierda. Si están por teléfono inteligente o tableta, se verá como la mano derecha. Si están por computadora, pueden ir a la parte inferior de su pantalla. Verán un globo que dice interpretación. Una vez que le den clic ahí, podrán ver unos modos apagado en inglés o en español. Si ponen clic en apagado es para la gente bilingüe que puede escuchar ambos idiomas. Si pueden poner en inglés, solamente escucharán inglés, o si ponen en español, solamente escucharán español. Cuando hagan clic en el idioma, ya tendrán la interpretación puesta. Si están por teléfono inteligente o tableta, se verá similar, pero tienen que ir a la parte inferior de la esquina derecha. Verán 3 puntos que dicen más. Cuando den clic ahí, verán un menú que se desglosa y tendrán la opción de interpretación de idiomas. Una vez que estén ahí, tienen las mismas 3 opciones: audio original para la gente bilingüe, inglés o español. Dan clic al idioma en que se sientan más cómodos y después ponen finalizado y tendrán la interpretación puesta. Muchísimas gracias al condado de Buncombe y a la Cámara de Comercio de Asheville. Thank you so much. We're ready to go.
Thank you, Rocio. The last year and a half has been really tough on everyone in this country and around the world, especially on businesses and on families that have kids at home. And if you go to a store these days in Buncombe County, about 52% of the total population is fully vaccinated. So that means almost every other person that you see could be unvaccinated. With the Delta variant, that has created a whole different situation for us, and we're going to learn more about that today. But all is not lost. We are not the same community we were 18 months ago. We know a whole lot more about how to keep our customers and our employees and our businesses safe and sanitized. We know what we need to do. The thing is, we have to find the will to do it. So we're going to talk more with a wonderful panel of experts today. Stacey Saunders is Buncombe County's Public Health Director. We also have Fletch Tove, who is Buncombe County's Public Health Emergency Preparedness Director. And we've got Dr. Bill Hathaway, who is the Chief Medical Officer of HCA's North Carolina Division. There are 2 options to participate in today's webinar. You can use the Q&A function at the bottom of the page, or you can raise your hand and you will be given the option to turn your microphone on. We're going to ask that you hold your questions unless you want to go ahead and type them into chat. That's perfectly fine. But otherwise, hold off on asking your questions until the end of the presentation. First, I'm going to call on Stacey Saunders, who's going to tell us what is going on and to provide guidance from public health. Stacey.
Thanks, Kit, and good morning, everybody. Thanks for this opportunity to talk with you. And I'm hearing that we have lots of participants today, so I am very grateful and so appreciative. And I think I speak to the rest of the panelists too when I say we are really, really appreciative of your willingness to come and participate in this dialogue with us, so that we can tell you where we are now as far as the COVID landscape and sort of what we're seeing as our current situation, and to talk about what tools we have that are a little different than what we were, 12 to 18 months ago, and then what we're recommending and asking. And I apologize. It never fails that a large truck goes by when I'm trying to have a meeting, and give you some thoughts about our recommendations for what we should be doing now. as we're seeing a level of high transmission. I'm going to share my screen and just, I thought it would be easier to give you this visual. So to give you some context, I don't have a lot of slides. I don't have any actually. I just have this time lapse of the US map that I want to share. And I want to give you some context that, just to give you an idea of like how very different it looks in just a month's time. Like why there's a sense of urgency is going to be illustrated in this map. And I'll just talk our way through it. And then that's the only thing I'm going to share, and then just sort of tell you a little bit more about the local level. So I'm going to attempt to share real quick. This is always the fun part of will technology work with me? Kit, are you seeing that? Okay, great. Perfect. So I'm just going to hit play here. And so we're starting at the beginning of July, and hopefully that little part right there will go away. What we're seeing is the beginning of July as we enter the July 4th holiday, and seeing that, gosh, we looked like we were in a pretty good spot there before the holiday and right around the holiday. But as we enter that first incubation period after the holiday, we start to see things change. And I do apologize, I've moved my cursor so that it would go away, but you can see North Carolina right there. And so really focus in, but you can start to see that things are really changing from that beautiful blue that we like to see to that yellowish, which means, gosh, this is sort of a warning light. And as we enter into the 2 weeks post 4th July in that incubation period, gosh, things really do change a bit. And we start to see much more of this orange and this red, and orange and red are high alert areas. That's the substantial and high transmission. And, you know, the western part of our state where we are typically has been in this place, in the past has been in this place where we tend to have less of that transmission for lots of different reasons. But what you can see is that is no longer the case. We are as red as any other part, and it's not likely that that's going to change in the next, you know, that we're actually going to probably see that increase. So now is a really important time to be talking. And so hopefully that illustrates that there is a sense of urgency that in just a month's time, we went from being in a really favorable place to a really not favorable place. And it happened very quickly. And I just wanted to share a little bit about what we look like locally, and that we have seen more than a doubling of our cases per 100,000 in 2 weeks. And that means that we are seeing now about 151 cases per 100,000 per week. We haven't seen levels that high since our surge back in the winter. So that is pretty alarming. And we are seeing about 50 new cases per day on average. The percent positivity, we like to be 5% or below. And we were for several weeks. We were just a month ago, we were consistently under 2%. And now, as of Monday, when we do our weekly metrics review, we were at 7.2% and rising. And likely to be at 8% probably pretty soon. And that, you know, that is just an exponential increase in the rate of transmission. And so that's why we want to talk to you all today, that a couple of the things that we noticed about the trends is that the overwhelming majority still of the cases investigated are in those who are not fully vaccinated. As Kit said earlier, right now it's roughly like 1 in 2 of us as we interact with each other. And it's younger groups that we're seeing the majority of all of our cases. And we know that currently we have no executive orders that are mandating anything in indoor spaces, and we don't have any local restrictions around that yet. So I just wanted, this is an opportunity for us to talk with you all to say, what are the tools that we have now that that is different than what we had a year ago, and what actions can we take, particularly as we know indoor spaces provide more of a risk than when we're outdoor, and trying to use some of the strategies that we saw that worked now in the absence, regardless of any state or local types of requirements. And so a couple of things. One of the tools that we have now that we did not have over a year ago is vaccine. Like, that's a big one. And I think all of you got, Kit, am I right? Everybody got, or at least it was sent out, the memo and sort of the some best practices. And so one of the things that we have now that we didn't have a year ago are vaccines. And we know that the vaccines that are available to us today, they're safe, effective, even with the circulating variant that we have, still safe and still effective. And so we're strongly recommending, that everybody gets vaccinated who is not, and that for you as a business partner, that you being able to really encourage your workforce to get vaccinated if they are not already. And we've heard of some businesses that are requiring that of their employees. So that's one of our.
Stacey, let me just interrupt for a second. The materials that were sent along with the invitation, in some cases, they may not have received materials yet, but they all got the invitation with the context established. Okay. Materials are available on a number of locations, buncombe.org, as well as Asheville Chambers /coronavirus. And you can go there and see the materials that are available, signage and things of that nature.
Great. So I'll just walk everybody through it, and then we'll move on. But in that document, it talks about vaccination, and that's one tool that we didn't have a year ago, and that our business partners can be really can help us in getting folks vaccinated, particularly as recommending and encouraging your own staff to do so. The other recommendations, it's an and, not an or. So it's right now, because of we're in a time of high transmission. We have a circulating variant that is far more contagious than what we've seen before. That's putting all of us at risk. And the reason that we get these variants that get stronger and stronger is that we still have a high unvaccinated population. And that is just quite literally, it is a breeding ground for a virus to come into the body. And I always say, I don't like to sort of humanize a virus, but it wants to survive. So what happens is it comes into the body, and while it's replicating, it is changing itself up, because it's like, hey, I've got to figure out a way to survive. And because humans are pretty smart, they're going to figure out how to get rid of me. So let me change up my genome so that I can become more contagious or more severe. Like right now, we have one that is really contagious, but not highly deadly, right? At any moment, we could be allowing the virus to change enough so that dyad changes to highly contagious, highly deadly. That is not a scenario we want. So the more that we get folks vaccinated, the less we give it an opportunity to change itself. That is the most important thing I need everybody to hear today. And in addition to that, because we are in a time of high transmission, it's an and of now we have to put back in some of the infection prevention that was so important when we didn't have vaccine. And so it's a vaccine and talking, strongly recommending you as business owners and owners of indoor spaces to require masks of the folks who are coming in, regardless of their vaccination status. That's the time we're in right now. And so if you take away just two things from me today, it's help get folks vaccinated, strongly encourage it. What we are finding is that folks who are coming in now versus of coming in earlier when they were still eligible, what is making a difference is that someone who cares about them and loves them and is close to them is recommending that they get their vaccine. That could be you. That could be you. And then The other thing I want you to take away from today is the top recommendation that I'm saying today is that as business owners and owners of indoor public spaces, we are strongly recommending that you require masks in your public spaces now, indoors. The other pieces are just additive onto that, right? And so we are recommending that you think about and put in place social distancing where and how you can. And if that means, like, if you're particularly, like if you're restaurants, if you have the ability to move people outdoors into space, outdoors is always better than indoors if you can do that. If you have the ability to make some more space in between tables, then do that. But at the top of that recommendation is, as people enter your space, keep them in a mask until they are seated and eating, right? And if you can put in the social distancing, let's do that too. And then of course, hand washing, which is like universal for all communicable diseases and just should be like good practice. Like we should all be washing our hands all the time. So doing that all the time. And then just making sure I didn't miss anything. And as a business owner, thinking about washing hands, like establishing places where folks who visit you can either sanitize their hands or have a hand washing station within the space. Okay, that's just making it very easy to make the right and make the healthiest choice. So when we put in things just as simple as like little bottles of hand sanitizer or hand washing station, we are making the healthy choice the easiest choice. And what we know through public health practice for decades now is that when we make the healthy choice the easy choice, folks will gravitate toward that. So simple things like just putting in stations where folks can wash their hands can make a big difference.
Bill, what were you about to add?
Yeah, I was just going to say, I think Stacy is spot on, and I have a few slides that I'm going to take a chance of sharing here. I'm not going to share, this is a talk I prepared for another venue, but I want to share some of these to emphasize some of the points that Stacy made. Now, are you seeing my screen? Are you seeing the vaccination slide? Yes. So this is our vaccination over time in the United States, and we peaked in April with the vaccine administration on a daily basis, over 4 million on a given day, and we've had a gradual decline since that time. In North Carolina, only half of us are fully vaccinated. We do much better as we get older in the 80% plus range for the older folks, and partially vaccinated is almost 90%. That's great because those are the people who get sick and end up in the hospital. So it's really, that's just a wonderful thing to see. But that means half of us aren't vaccinated. And if we're to get to that herd immunity that we talk so much about, we have to get to that 85 to 90% or 75% range. So it's really critical that we all look at that. The other thing I wanted to share was how this is affecting our hospitalizations. This is what we've seen at Mission Health System. The blue line is hospitalizations over time. The bottom is our graph of time itself. And you'll see that since July 4th, just as Stacy showed on that US map that became so bloody red, we have seen a significant and substantial increase in the number of patients. We're not to the levels that we saw in January, okay? So that's good news, but it's going up too fast and too quickly. And there are predictions that we could even potentially end up back where we were in January or exceed that. This is a graph here, and I'm not going to spend too much time showing data, but there's just a few more I want to show. This is a graph that shows the excess deaths, the number of deaths that have occurred because of COVID. This goes back to 2017. We say we have a very predictable number of deaths in our country, but since May of last year, those numbers have skyrocketed. This is a mortal illness, folks. This is not just a cold for some people. It's taking mothers and fathers and sons and daughters and grandpas and grandmas and all kinds of people from our lives, and we need to do what we can to prevent this. I want to show, there's an interesting slide here I want to show you about the efficacy of vaccinations. We know that the Delta variant is evading the vaccines. We know that there are post-vaccination infections or breakthroughs, as people have seen, but it doesn't mean that the vaccine's not effective and not working. So when you look at the risk of disease in vaccinated people versus unvaccinated people, or the risk of being hospitalized or the risk of dying, there's an 8-fold decrease in cases in those among those who are vaccinated. It decreases your risk of being infected 8 times. There's a 25-time decrease in both hospitalization and death from being vaccinated. So when you hear people say, yeah, but I've got infected even though I was vaccinated, might be the case, it's less likely, and it's almost assured that you won't be hospitalized or suffer the severe sequelae. So as Stacy pointed out, I think it's really critical that we do what we can to get vaccinated. And then as we look towards the future, and you remember what Stacy said about vaccinations and about masks, we know that vaccinations are effective. That's our left hand in this fight, right? And we know that masking is effective. That's our right hand in this fight. And if we make some projections, and these are projections, it's hard to know if they're going to be accurate or not, but it's the best that we have. Our current course says that this peak will peak in the early part of September in terms of cases, and hospitalizations and deaths will lag towards the end of September. But it could be worse. We don't know. It could be peaking as late as early October. And we do know, however, based on our experience with masks and vaccinations, that masking can dramatically change the shape of this curve. Remember early on, we spoke at length about flattening the shape of the curve, flattening the curve. This is what that means. And it's really critical that we do everything we can as a community to make this happen.
You guys, I want to go ahead and throw a rat on the table, a couple of rats actually. One being that I know that employers desperately want their people to get vaccinated for the most part, but are very uncomfortable about any requirement for vaccination, and instead have tried to encourage. And I think it's really important that we try and keep the heat out of this conversation and avoid the way it's been politicized in the past. I don't believe has been helpful. And so one thing, our mayor was telling me that at the Van Winkle law firm, that their rates were not where they wanted them to be. So as a result, they decided to offer an incentive of a $50 gift card to Ingalls. And as a result of that, got to 95% vaccination. Incentives now are available from the state level as well for people where that can matter. I just encourage you to try and keep the heat out of it, and instead to think about avoiding shutdown of businesses, avoiding shutdown of schools, which of course we would have to shut down if we got to a certain point and everyone was endangered. I don't think anybody wants to go back to that. So if we can all work together to avoid those types of shutdowns by encouraging vaccination, providing incentives, and helping our employees every way we can, as well as Stacy so poignantly pointed out, talking with the people we love who may not be vaccinated, to encourage them to please do it for themselves, for your families, for your friends, etc. But there are lots of things that we can do to keep ourselves safe. And I know Fletch was communicating with us on a regular basis, communicating with the public about what those things are. We've already heard from Bill and Stacy about some of them, but Fletch, do you want to talk about what businesses can do?
Hey, Kit, I'd be happy to. I do want to take one step back real quick, though, and talk, as I've been talking with different groups, I feel like I've been getting a lot of questions kind of more about what the Delta variant is. So I just want to kind of take one step back. I want to share just one image. This is from California, from San Diego County, but it's really indicative of what's happening everywhere. And it's such a clean, stark graph. I think it just really captures what's going on. And that this green line across the bottom for the last several months is infections after vaccination for those fully vaccinated. And this gold line is those not fully vaccinated or not vaccinated. And you can see this taking off like a rocket. and that this is the start of an epi curve. And locally, although our numbers are low, those changes are statistically significant because we're seeing doublings or triplings. It's just indicators to public health that we're seeing some kind of start of a curve. And all these conversations for me are a lot of deja vu because it's the same thing we were at last year. We're talking about flattening the curve again. We're talking about 3 Ws again. And so I just want to talk about the Delta variant. Is that it's anticipated that about 85% or more of new cases are due to the Delta variant. And we're seeing with the Delta variant more 20 and 30-year-olds hospitalized than we were with previous strains. And with previous strains, where maybe if we anticipated that somebody who is contagious would only infect 1 or 2 people, with the Delta variant, that may be as high as 6 or 8 people. So it's almost tripling how infectious that was. So this is kind of why I think you guys are seeing headlines now all of a sudden, especially over the last couple of weeks, about the concern from public health nationwide about the Delta variant. So I just want to kind of catch up on that real quick. But I really don't have anything to add about what we could do to be safe to what Stacy said. In the materials you guys got, there are really strong recommendations from us, from public health, to what you guys can do to safeguard your business and safeguard the community. It's very similar to what we said last year, but the big game changer is now that we have vaccines, and vaccines is really what gets us through this. So we're still gonna strongly recommend indoors in your workspaces wearing masks. We're gonna recommend the social distancing and hygiene, but really anything you can do to encourage your families, friends, staff, employees to get vaccinated really kind of solves all those problems for us. So that's the biggest ask. As far as executive orders, locally, we're no longer under a local state of emergency. So unless we reinstated one of those, we won't have any local restrictions or mandates until you see that. And the rhetoric from the state, at least for the last couple of weeks, makes it seem like the governor intends to let this state of emergency expire. So that's what we're looking at right now. But with the data changing as quickly as it is, I think there's still potential that the state could kind of change its course. And we got this question a lot last year. We don't really get heads up what the state's thinking. Sometimes we're finding out watching this broadcast live with you guys. But I think the state has been driven by data in this whole response for the last 18 months. And I think when they see the same kind of trends that we're looking at, they'll make the appropriate decisions.
You know, there is strength in numbers. And if the business community decides that we're going to mask up as a community in order to avoid the spread and to keep our numbers tamped down, we can make a difference. We can make a huge difference. We at the Chamber have already made the decision that we are requiring masks of both vaccinated and unvaccinated if you come to a Chamber event. So that's starting tonight at our business after hours. And our own staff, we've got 100% vaccination of our staff, but we have guests who come in. So we're masking up when we're in central areas together. So think about that, if you would, please. Bill, you showed us briefly a Delta variant slide. You want to do that again and tell us?
Yeah, let me just tell a little bit more so people have an understanding of exactly what we're talking about with respect to this Delta variant. I think you can see this on here. Oh, it just went away, didn't it?
Yeah, it did.
Okay, there it is. Oops.
There it is. Whoops.
Got to get to the right one. Hold on, bear with me. Okay, I hope you can see this. On the bottom, the x-axis here is how infectious or contagious the illness is. As you move to the right, you get more infectious. And as you move up the graph on the y-axis, you get more fatal. So the bird flu is highly fatal, but not very contagious. Ebola, very fatal if you get it, not super contagious. Measles, very, very contagious and moderately mortal. The difference between the original coronavirus and what we have now is that it's much more transmissible. It looks to be perhaps as transmissible as chickenpox, which is highly contagious. And those of you who are as old as I am, remember we used to have chickenpox parties to get people infected because you then developed immunity and it didn't cause a lot of long-term sequelae. the problem with the Delta variant, and there were, believe it or not, SARS-CoV-2 virus parties early on, God forbid, what a mistake that was. But that was before vaccines. It is much more transmissible and every bit as mortal as the original variant. And so for that reason, we have our grave concerns about what's going to happen with this variant. And that's why it's infecting people who are already vaccinated.
And by the way, Bill, we've been seeing lots in the chat about people wanting copies of your slides. And
yeah, we'll figure out a way to make them available. I'm happy to share them. The whole deck it's much more comprehensive, but some stuff I think you'll find very interesting. And most of the stuff that I take actually and put into my presentation, some of it is specific data from our health system, all of which I'm happy to share, but a lot of it is publicly available. And so I list the reference sites on the slides too, so you can go to those websites.
Another rat that was mentioned was whether or not the merits and debates of requiring vaccination by employers. Some of the employers I've talked with they are hesitant because of the very tough labor market we're in right now. And so they have concerns about requiring vaccinations. As a result, they're just hesitant about it, and instead have been trying to use the carrot rather than the stick. We know that the county has asked all their employees to either vaccinate or to wear a mask full time and test weekly. And that's certainly an option for business as well. We are a right to work state. You could require it if you chose to. Again, there's strength in numbers, but that is going to be up to the individual business owner about what you want to do. I think talking about shutdowns and avoiding shutdowns and sending kids home and sending people home is probably a pretty powerful incentive. I mean, I know I don't enjoy wearing a mask either, and I chose to get vaccinated. I hope others will make that same kind of choice, but we need to do what we can to hold things down. Stacy.
Yeah, so I was just going to build off of that and say that's right. It's every business, like every business has to make that decision for themselves. There are businesses that there are businesses that haven't, and even in both of those situations, they're in the businesses that have and haven't, they've also then layered on other protective measures. And that's what we're talking about now. So if you're a business who feels strongly and you want to take that next step, businesses are mandating it. Yes, that is true. If you're a business that has some reservation about that, there are still other things you can do that can have an additive effect. One of them is if you're not in a place where you're going to mandate it, then work with your vaccine providers in your area to offer vaccine on site or in a location where your employees can get it pretty easily. That's one of the factors that we have noticed that we've like over time that we've seen is that for some folks, it's not that they're vaccine hesitant. They're not vaccine hesitant at all. They're not opposed to the vaccine. It's just that they can't get off of work to get it. It's too far for them to go. They're afraid if they have a side effect like, gosh, my arm's sore, or maybe I run a low-grade fever that I can't miss work, right? So there are things that businesses can do. One being strongly encourage your folks to get vaccinated and be a business that offers it on site. You can contact me or Fletch if you're interested in doing that. And we have an outreach team that is made up of our folks here at Public Health, but also we bring together all the vaccine providers in Buncombe County, and we work together to make sure that folks who want vaccine at their work site, we come there and do it, whether it's going to be Public Health or it's going to be one of our other vaccine partners or maybe our state resource of StarMed. So those are all options to help encourage. And then the other pieces, some businesses who have not mandated or have Also offer an incentive. So Kit's right, like and it doesn't have to be monetary. Some businesses will offer just some PTO, that if you go and get your vaccine, not only do you get to use that as work time, but then you get some PTO in addition to that. I will say, like, we have not gotten our summer cash cards yet, and we've not implemented that yet, but we are hopeful that we're going to be able to do that any day now. And so Buncombe County HHS will be participating in the summer cash program that DHHS has, which means that when we go out, or when folks come here to our health department to get a vaccine, if it's their first dose, they will be eligible for $100. And we have that for a short period of time, but it might be just the right period of time right now to do that. And then, as Kit said, the other things that you can do are those layered approaches for infection prevention of your patrons, your work staff, requiring a mask regardless of their vaccination status right now, and social distancing as much as possible. I did see a question come up in the chat, and I'm not sure if someone's moderating that, about what percentage are who are fully vaccinated. So what I can tell you of the cases investigated, the last 2 weeks, the cases that have been investigated overwhelmingly, like 90% plus, are in those who are not fully vaccinated. And that's a trend that's happening at our state and at our national level too. We have seen that come down a little bit just about a month to, I don't know, 6 to 8 weeks ago. That percentage was around 96% were not fully vaccinated. Now we're hovering in the 90 to 92%, where depending on the week that we're in. And that is showing us how very dangerous the Delta variant can be, because like I said before, and Bill reiterated it too, that we expect to see some of those post-vaccination infections. But that doesn't mean the vaccine's not working. The vaccine is very effective at preventing illness, preventing infection, but also if you are a vaccinated person who then does unfortunately get infected, it's really, really effective against severe illness, hospitalizations, and deaths. And at the end of the day, like, those hospitalizations and deaths are going to be some of the most influential drivers as to what we do next as a community.
Yeah, I put that slide back up to reemphasize what you just said, Stacey. And I want to go back to the mandate for a second, because there's a lot of issues around that. And frankly, I took a little heat at the county commissioner meeting this last week for HCA and Mission Health not mandating vaccinations in all of our employees at this point in time. I think people realize the vaccine is currently under what we call an emergency use authorization, meaning that the risks and benefits were weighed, and it was decided in this emergency situation that we're in last year that the potential benefit of authorizing the vaccine for use outweighed the risk. But it didn't mean that we had all the data that we wanted. We recognized the urgency and the need, and so the FDA said, very important to get this. Sorry about that, getting a call, I got a decline. Oh well, so but they're now moving towards full biologic license approval, and we believe that will happen for the Pfizer vaccine in September of this year. That's the latest news. And all that means is that then the full stamp of approval, to the best of our knowledge, this is safe and effective, that the benefits outweigh the risk, are going to be in place. And I think at that time, you will see many universities, many healthcare systems, many businesses feel much more comfortable mandating vaccination among their employees, because it's gotten the full approval. Right now, I have a little bit of an ethical conundrum saying, you know, when the FDA says we can't give something because we don't have enough data, that we shouldn't do it. But now that we haven't fully authorized it, that we mandate it, it doesn't seem to make the kind of sense that I would like. Now, that being said, I fully believe and insist that, believe that everybody should be vaccinated, both our employees and our staff. It's in the community in general. I believe we have hundreds and hundreds of millions, if not billions, of doses of this vaccine given to the populace, and the side effect rate is small. The efficacy is proven, and we fully support vaccination. That being said, the most important thing is to mask too, because we can mask right away. Vaccines and masks are, as I said earlier, the left hand and the right hand, and we can get really the biggest bang for our buck by doing both.
And we can, that is something that is within our control. Another rat on the table. There are lots of people who are very concerned about how you confront customers coming into your place of business we've got, by the way, there's signage, and I misspoke earlier. It's buncombeready.org is the website address, as well as the Chamber's website address, Asheville Chamber /coronavirus. You're going to see signage options there that you can use about your desire for folks to wear masks. At when they're coming into your store. It is your store, and while people don't want to have to be confrontational, and I encourage you not to be, I encourage you to take the heat out of it, to say we are voluntarily trying to avoid further shutdowns of businesses and schools. So we've decided that we are asking everyone to please wear masks when they come into our place of business. So I encourage you to work with your staff. In fact, I was talking with mine saying, if there are individuals who are uncomfortable with that stance, are we going to turn them away if they show up at our event tonight? We're not going to turn them away. We're going to say we are simply trying to protect our community from further shutdowns that are so disruptive to everyone. And we would ask you to please consider wearing the mask. And if they refuse, we're not going to turn them away, but we're hoping we're going to have a supply of masks there and hope that people will choose to do that, because we aren't under mandates. We don't want to be under mandates, but by taking these steps, we can avoid that, and we can help flatten that curve that has already been discussed. Similarly, again, you may not want to have conversations with your staff. I urge you not to get into the realm of political about this, because people feel so very strongly, and we need to respect people's political positions, but talk about the need to not send people home, for them to lose their incomes, for kids to be in schools, for kids to not be in school, and working parents impacted, plus those kids whose parents don't have the wherewithal to sit on them. Can we afford another year of kids not learning? The schools have done the best they can, but it's up to us to take the steps we need to take to be leaders, to encourage the best possible behavior. Vaccination, preferably, because in the long term, we really need to reach herd immunity so that we don't have a variant beyond Delta. Variants, as Stacy said, they get worse. They don't get better over time. So we've got to nip this in the bud. In terms of the websites for signs, again, buncombeready.org. It has materials that you can use, that you can copy off. The letter that Stacy was describing is there. Also, the Chamber has actually put together our own variation on a theme and put together masks reflecting our desire not to see shutdowns, and therefore our voluntary request for people to mask up, because we also quote the CDC, because the CDC has recommended mask wearing when you're in a group setting. So we're including that. We've got signage that we've produced. You may go there, and you're welcome to R&D, rip off and duplicate, because it's there for your usage.
Can I make one comment,
Sure.
Kit? And I'm going to take I'm in the business community in the sense that we have 10,000 employees in our organization locally. But clearly Stacy and I we come from a different perspective, being in the public health perspective. And my personal perspective is that I frankly have zero problem with mask mandates, because we're talking about saving lives. We're not talking about inconvenience. We're talking about someone, if we allow the chain of transmission to continue, we will find someone, as we have, who's vulnerable and can be infected and die. And in fact, I think people are aware that there's a report in the media about a patient who was 31 years old, who had 2 children, had delivered a baby, and the baby's in the NICU and passed away from COVID. So this is a very real issue. And I've been thinking about this a lot. I thought about and of course, most of us now we're not alive during World War II. But if you remember, that was a global challenge like no other that had been faced by man at that point in time. And the challenge, in order to be met, demanded lots of sacrifice and joint effort on the part of the United States. Some people made the ultimate sacrifice. They went overseas, fought, and lost their lives. But many sacrifices were made at home collectively. Rationing, a variety of different things. Industry was changed over to help the war effort, et cetera, et cetera, et cetera. It was a collective effort on the part of people, from lights out early to saving oil, to not using gasoline, to recycling tires, et cetera. It's something that people rallied around together in the best interest of not just themselves, but the entire community. And it's huge, significant sacrifice to themselves. We're asking a minor sacrifice right now. We're asking people to wear masks. It's inconvenient, it's uncomfortable at times, but that's really all it is. It's not an infringement on personal liberties. It's an ability to help protect your fellow mankind. And I think it's really important that we do that now to bend this curve. This is, in order for us to go far and get through this, we need to maintain our diligence right now. We've seen what's happened as we let up on some of these restrictions. We have a variant that's come along, and we've seen a rise in cases. As Kit has said emphatically and passionately, we don't want to go backwards on our economic and personal freedoms. We want to move forward, but we have to do it slowly. And these are the things that are going to be necessary to do that.
Thank you. There's a question here about a festival that's planned for 2 months away, and that they've been advised to hold off on the cancellation decision because it is 2 months away, and other events seem to be moving ahead. Are there measures that, first of all, is it reasonable for them to wait on a cancellation decision? And second, are there measures that could be taken to collectively improve public safety? Who wants to answer that one?
Fletch, maybe you and I can tag team this one. My first question would be, is it an outdoor event? And so if it is, so a couple of things that Fletch touched on, and then maybe I'll just let Fletch cover it from there. But there are no current executive orders or local restrictions around event capacity. Right now, we have recommendations for how you conduct those. And even an outdoor event, while outdoor is better than indoor, even with outdoor events, when it is a crowded outdoor event, we are still recommending, because crowded, that means even if it's outdoors, if you've got bundles of people together, it's still a recommendation to require the masks for crowded outdoor spaces. And so, Fletch, I'll stop there because I know you've been covering much more of this. And I did want to say, after this question, Bill, we've got some questions around boosters and some around the adverse reactions. And so I'll cover boosters, but you had some really great information around the VAERS data and stuff that would be great to share, I think. Okay, go ahead, Fletch.
Yeah, Stacy, you really hit the nail on the head with that. There's first thing to consider is whether it's indoor and outdoor, because we know it's really changes the landscape. And again, if it's, I think we could kind of determine whether it's a dense outdoor or kind of loose outdoor, depending on the event. If we're kind of like the things where people are stacked up for a concert, that's pretty dense. Definitely recommend masks. And as Stacy said, at this time, there's no restrictions or requirements for that. But what I keep reminding people is that the landscape changes very fast with the data. So 2 months away is a long time as far as 2 months of data and what the state's going to do, what we'll do locally. One thing I think has been really successful as we've helped people navigate events over this last year is that a lot of times you're going to have, whether it's a formal direct contact with people who have already signed up, or whether you have like social media pages, start early, telling, you're an opportunity to educate these people coming to the event. Let them know that trends are increasing now. Let them know now what they can do. Because 2 months away, if they're not vaccinated yet, to be fully immune, it's not just your first shot, it's your first shot, your second shot, and then 2 weeks out. So use that as a talking point. Like, now's the timeline to start your vaccination so you're ready for this event. Start encouraging them, start laying the groundwork now that this very, very well may likely be a masked event outside. We may require masks. And so I think that's for the events. I do want to touch on something, speaking of masks, is that although it's a recommendation, you guys as individual business owners have the right to require that for entry to your business. Same as if you would ask somebody, hey buddy, you need to go outside if you don't have a shirt on. You can ask that with a mask. And I know this is not as easy on the ground in practicality, but what we determined last year is that continuum is if you determine you're going to require that for your business to be in a mask, and somebody comes in maskless, you inform them that's your policy and ask them to put a mask on. If they refuse, at that point, you can ask them to leave, as that's your business requirement. If they refuse to leave or escalate at that point, you can call law enforcement. And that escalates at that point into trespassing. I know that's easier said than done, especially if you have front of house staff, trying to get somebody at the front and they're escalating. But local law enforcement has told us you don't have to use a non-emergency number for that. Call 911. And so that would be the continuum if you guys choose to enforce that.
All right, what about boosters?
So currently at this time, there is no recommendation for a booster, not yet. Bill, keep me honest, I think that the WHO just actually released a statement, maybe just in the past couple of days, that, particularly right now where less than 10% of our global population has even been vaccinated, that a priority should be to make sure that some of our other lower finance types of countries are getting, or lower funded types of countries are getting better vaccination. But that's sort of a global perspective. For the US, the FDA nor the CDC has made a recommendation around boosters at this time. So
that's exactly right. But that being said, my gut instinct is that we are likely to see over time, as the virus changes, a need for additional vaccines, just like we do with influenza. I know that in California, they're actually calling in San Francisco for people who got the J&J shot to get a booster shot of Pfizer at this point in time. There's not a lot of data to support that. We know that if we could target the vaccine to be more specific to the Delta variant, which is in the works by all the companies that have vaccines right now, we would, increase our immunity. But I believe that over time, we will see recommendations for boosters, perhaps on an annual basis. It remains to be seen.
We had a couple of questions about rapid testing. And Bill, I saw that you responded with Senesco Labs as one location for local and rapid testing.
Yeah,
any other ideas?
Well, they're a local lab that I really want to support because they've been instrumental in helping us get to some of the historically marginalized populations in terms of getting testing done. And so I give them a shout out. They're locally owned, a minority owned business. So lots of reasons why we want to do it. And they've been such a good partner that that we want to encourage their use.
Do you have any sense of what it costs to get a rapid test?
Well, right now, all testing is billable through insurance. and that there should be no cost to the individual person for the testing as it's done.
So that's folks, and if you know of other rapid test locations, feel free to enter those into the chat as well, or if you know anything about for those who may not have insurance, what the implications might be. Let's see, other questions. We've talked about boosters. We've talked about the website. How to handle anti-max yeah, Explore Asheville is hosting a webinar in September about handling people who are opposed to wearing masks. That is a great resource. It's in the chat. So please look for that as an option for training with your staff, should you have a front-facing organization. One of the questions we got was there are folks who have an office, they're vaccinated, they don't have a public-facing business. Do they need to wear masks?
Yeah, so this gets back to that, do everything we can to prevent transmission. So as an example, we have an administrative office here in Biltmore Biltmore Park, right near Town Square. And we have gone to masking indoors when we're with other people because it's what the CDC recommends. It doesn't, it's anytime you're with people who aren't inside your immediate family, you should consider masking. It's the right thing to do. It's easy, it's safe. That's our guidance.
Yeah,
Okay.
that definition of public space is not necessarily like, it means like not your home. Like meaning that you are interacting with people who you do not live with, and you do not know where they were, right? So when you're in your office solitarily, obviously I'm not wearing a mask, Bill's not wearing one in his office, right? And so, but when you come into interaction, you've got it, I know we've got them handy in case someone comes in, but if it's about interacting with other people, because we do have and primarily because we have such a high level of transmission right now with a variant that is much different than our original strain, that we are strongly recommending that when you're yes, that you should be wearing a mask when you're in indoor public spaces and not in an office by yourself. So when you're interacting with other people, mask up. Yep.
Yeah, and the question, we just got a question about 1 or 2 masks. 1 is better than none, 2 is better than 1. It's pretty common sense. The masks, as we have learned over time, as much as they protect us from other people, they also protect other people from us if we're asymptomatically infected. And up to 20% of the infections in people who are vaccinated are actually asymptomatic. So you might not really realize you're infected. Another reason to wear it when you go out so you don't harm other people.
Folks, I've also seen in the chat that party urgent cares have rapid testing. Tests are completed in 40 minutes. So that's another option for those of you who need to send an employee for a rapid test or something of that nature.
Yeah, Mission My Care Now, MAHEC, most of the providers, the Sisters of Mercy urgent care will do testing too. So, it's pretty widely available if you need it.
There's also a post here about a state website that can help find testing locations. So please look at the chat. We will be capturing the chat as well so that you can have that as an option, and any questions that don't get answered today will be responded to. Advent Health and Arden, Advent on Airport Road, those are also locations.
There is a question that's asking about rapid tests versus other tests. So almost all the tests that we utilize right now are PCR tests. They look for the DNA of the virus as opposed to the antigen of the virus. I won't get too scientific on you here, but early on, the rapid test was only the antigen. We've come a long way with our PCR testing in terms of availability and rapidity with which we can do the turnaround. The PCR testing is the better way to go. We can no longer distinguish between antigen and PCR by rapid. we can do rapid testing very much so with PCR now.
So a couple of things that I saw pop up. So Bill, after I do these two things, if you'll cover those, the VAERS thing.
Yeah.
Folks are asking about when will the little ones, less than 12, be eligible. Yeah, I don't have an exact date. Nobody has an exact date yet, but everything that we're sort of hearing is late fall, early winter to get those trials through. And then someone asked if about CDC recommendations for quarantine. Big blanket statement is the local health department follows the CDC recommendations for all isolation and quarantine. And North Carolina DHHS has adopted those CDC recommendations. So they are a part of the North Carolina Communicable Disease Manual and protocols for local public health to follow.
Okay, and
So Bill, if you'll cover those adverse reaction things that I think are popping up a couple of times that folks are.
Yeah, so there's lots of questions about the side effect profile of these vaccines. And as I said, we've administered billions across the world, 160 million people fully vaccinated in the United States with well over 350 million doses given, because many require 2 doses, of course. When we looked at 200,000+ people in HCA, we found that the serious event rate, meaning serious adverse things, not just site irritation. You're going to get site irritation. You're going to have some redness sometimes. That can be highly variable. Sometimes it's more severe in some people than others, but it's transient and not permanent and not life-threatening. You'll get aches and pains, fever, chills, some of the viral syndromes, because it triggers your immune response. Of course, you're developing antibodies, and that triggering of the immune response is what we feel when we get sick. That lasts for 24 to 48 hours. Those are minor and occur in 20% of people or more. The very serious bad side effects are exceptionally rare, 0.00026%. So not even, way less than 1%. And we know that the mortality of COVID and Delta is just as mortal as the other variants. I think people need to know that it's not just like a cold. You can have cold-like symptoms if you're vaccinated, but overall, if you're not vaccinated, the mortality of COVID is 1 to 2%. So you're looking at 0.00026% versus 1 to 2%. There's no, from a risk benefit point of view, it's no comparison.
folks, we have run out of time. We're actually over time a little bit. I just want to remind you that there are resources available, the materials that we've discussed today, signage, and the other things that you can use to take your destiny into your own hands are at buncombeready.org, as well as at the Chamber's website, ashevillechamber.org/coronavirus. I want to thank our panelists for joining us today. We will make every attempt to answer any other questions that were asked that were not answered. And thank you all for participating. Please, let's be leaders out there and let's hold down this virus. Thanks so much.
Appreciate it.